My name is Sarah Titman. I'm a women's health physiotherapist working in the community in Sheffield. The pelvic floor is a really important set of muscles that spans from the front of the pelvis at the pubic bone to the back to where the coccyx sits at the very base of the spine. These are the bony attachments, but it also, as you can see from this model, spans the rim of the pelvis as well. And it's in 3 layers. So there's the deep part of the pelvic floor, there's connective tissue, a bit like cling film that sits in between and provides more structural support. And there's also the external part of the pelvic floor, which helps to control around the urethra, the vagina and the back passage. So it's a pretty complicated set of muscles, but it's got a really important job. And the main thing that we're going to teach pelvic floor exercises for you today is in regards to continence. And that, for most of our patients, is for the bladder, and we're looking at stopping any unwanted passage of urine, but also these exercises are really important for the back passage and to make sure that we've got good control of our bowels. And the final aspect of this, which again is something that we would see regularly, is to give exercises to support the vagina and any symptoms of prolapse, whereby the organs are moving downwards towards the opening. And we know that with pelvic floor exercises, increasing the bulk of these muscles helps to elevate and lift that prolapse so that it's not bothersome and the symptoms improve. So the way that the pelvic floor that exercise used to be taught was to really focus on the front and imagining, a lot of this is visualizing, imagining stopping the passage of urine. But actually what we now know through copious amounts of research that's been done, actually this needs to be started at the back. So imagining that you're stopping the passage of wind. So the best way of doing that would be to sit down as I am on a firm surface and engaging around the back passage, squeezing upwards and forwards. So the motion of a pelvic floor lift, if you imagine this is your tummy at the front and this is the back passage, that it's an engagement upwards and forwards, and that kind of motion in order for the urethra to be clamped up against the pubic bone and that pelvic floor to engage optimally and provide the most support. There are 2 types of exercises that we would recommend doing. One of them is a slow contraction, and this helps to give bulk to the muscle. The best way of doing this is to imagine that you take a deep breath in. So as you inhale, the diaphragm moves down, your tummy is nice and floppy. As you exhale, we're going to do that activation, so initiating around the back passage and trying to maintain that contraction as that breath is finished, and then you start normal breathing. So take a breath in. As you exhale, engage around the back passage, keep that contraction there. Ideally, we're trying to hold that for 10 seconds, so engaging and keeping, ideally talk to somebody or maintain that breathing, that normal breathing for 10 seconds and then drop it down. And what we would like you to try and repeat is to do that 10 times in a row, but make sure that in between each of those 10-second contractions that you have a rest before you do the next one. What I would say is the reason that most people come to see us is because they're having symptoms and they can't do that. So start low. If you can't feel that that's still holding on, it's probably not, it's probably gone. And therefore that might be, you might only be able to hold on for 3 seconds and repeat it 5 times before you can't do any more, or your muscles are too tired. And that's fine, but then the idea obviously is that you increase that and progress it. If this is too difficult and you don't know how you're doing it, then obviously we need to see you individually and make sure that we teach you how to do these exercises properly. The next type of exercise are fast squeezes. So it's the same technique, again, from back to front. So squeezing back passage towards your pubic bone, so it's up, but then it's a very much letting go. So imagine on a graph, it's a contraction, then letting go, but then resting for 2 seconds. And then again, 100% hard as you can, up and then let go. Again, ideally repeating that up to 10 times. Some people can do 20 to 30 repetitions, some people can do 5, and that's fine, but that's your baseline, and then you would increase it from there. The other part of pelvic floor exercises is to make sure that we can activate these functionally. So doing these, for example, if you have problems with coughing or sneezing and you leak with those activities, to try and activate your muscles before you know that you may be vulnerable to leakage. So if you were to cough, you would engage your pelvic floor and then cough or then sneeze, or functionally lifting, so you would engage your pelvic floor before you lifted something that you know may make you leak or may be troublesome, so you engage, then lift, or do an activity that you know might be more difficult normally. Doing these exercises, really, you need to focus on how you're doing them. These aren't exercises that you can do when you're doing other jobs, or even when some people do them when you're driving. You need to sit down and really focus on how you're doing these exercises, and also put the time into them. If you're going to do them, you want to do them well and do them correctly. Some people do this when they're breastfeeding and feeding babies, which is fine if you feel that you can focus, but you must be able to really pay attention to how you're doing these exercises. There's an NHS endorsed app called Squeezy, which is I'd highly recommend. You can put in how many exercises that you can do, and it gives you really useful reminders that can help to help you adhere to doing these exercises on a regular basis. So that's Squeezy on the App Store. And then finally, there's a big association between the pelvic floor internally and the musculature externally, and the glutes play a really big part in this. So we know that the glutes and the pelvic floor work together. So doing the pelvic floor exercises in isolation is a great place to start, but then quite quickly building up to do some glute work, again, is a really useful way of supporting the pelvic floor in order to help with any symptoms that you're getting. For example, doing glute squeezes or doing any specific glute exercises, which we're going to give you some other information in a separate video, bridging, sit to stand, squats, lunges, those kind of exercises can help to engage the glutes, which again we know will help from a more localized strengthening perspective. Thank you.